So hi, welcome to another episode of Drugs and Coffee. Today is just me and Joann, and we decided to just have a little session where we would talk about things that we find interesting, either in the news or just by searching the internet. And we did come up with two very interesting topics. Before that, please go and subscribe to our channel. A lot of you are watching, but not many of you have subscribed so far. We are new, but please follow us. We're kind of cute, so you know that's fine. Yeah. And today we have two topics. Joann found a very interesting topic about antiphospholipid syndrome, which I found very fascinating, and I ran into topic of blindness and schizophrenia. Apparently, if you were born blind, you're actually protected from schizophrenia. So there you go. So we're going to start with Joann, and she has a very interesting topic for us.
All right, let's get to it. So today what I did was I looked up a little bit about antiphospholipid syndrome. The topic came about in an interesting way. First of all, a lot of women suffer from recurrent miscarriages. That's what led to that. And I have a couple friends, a couple coworkers who have suffered from that. And so this syndrome may point you in the direction to helping you solve your problem. Of course, you need a professional diagnosis, and we're not here to say that, but it's just an interesting topic. And so here it goes. So if you suffer from a lot of, clots, thrombosis, prematurely, that is prior to an elderly age, or if you suffer from recurrent miscarriages, this syndrome may be the cause of it. And what they discovered, I believe it was in the 80s, they discovered that a lot of people suffered from high antiphospholipid markers in their blood tests, coupled with clinical manifestations. So they would suffer, in addition to that, they would suffer high numbers of miscarriages. They would suffer from premature heart attacks and clots in different parts of their body, like venous deep vein thrombosis, so clots, DVTs, as well as clots in their lungs. And coupled with these clots, they would have high antiphospholipid markers. Now, these are just three different markers that can occur in the blood. There's anticardiolipin. They could find that antibody. They could find the lupus antibody, anticoagulant marker, as well as the anti-beta-2 glycoprotein antibody. So what these antibodies are basically, they are antiphospholipid markers. So what's a phospholipid? So your cells are made up of a phospholipid bilayer. Okay. And at some point in your life, when you are exposed to, say, bacteria or certain viruses, you can form antiphospholipid markers. Antibodies.
So
correct.
Antibodies that actually attack your own cells. So it's autoimmune.
I did neglect to say that. It's an autoimmune disease.
So these antibodies that form, they will go back and attack these. Right?
Yeah, that's correct. Okay. That's correct. So it can happen in healthy individuals. So you would have these high lab markers for these antibodies, that have formed because of your exposure to certain viruses or bacteria. So having just the lab markers is not sufficient to diagnose, antiphospholipid syndrome, right?
So how do they? So just having one miscarriage would not mean that you have this syndrome, right?
Not necessarily one miscarriage. They typically, it depends on how late the miscarriage is. If it is between, if it's anything under 10 weeks, you would have to have possibly 3 miscarriages in order to diagnose that, in addition to having a lab marker like a high antiphospholipid antibody.
So if you have
say if you
one miscarriage,
yes,
that's what?
That is not the criteria for that. If you've had one miscarriage and it's post 10 weeks, then that coupled with one lab marker would lead to that diagnosis.
So if you have one miscarriage post 10 weeks,
yes,
right? and one of these lab markers, then you consider to have the antiphospholipid syndrome.
Correct.
Okay? And then you get the treatment that will prevent you from having an episode, right?
Yes.
Now, if it's before 10 weeks, is that...
If it's before 10 weeks, if you've had a different clinical manifestation, if you've had some sort of clot, okay, and they determine, like, you had a blood clot in your leg, okay, that would serve as a clinical marker. That, in combination with a high lab marker, would lead them to on the diagnosis towards antiphospholipid syndrome. I mean, we can put a link so they can look up specifically, because we are not doctors. We are just trying to pique interest in this subject matter.
No, it's very interesting, because I'm sure that a lot of people out there that are not diagnosed, they could be diagnosed and prevent future miscarriages.
Absolutely.
Right? Because really the treatment, the way you explained it to me,
the cornerstone for treatment is to give them something that will stop the clotting, you know.
Because the syndrome puts you at the risk of clotting.
So they want to keep them, the fetus healthy, and of course the mother healthy. So you don't want the clot. So you would take antithrombotic therapy, or so in some cases you would take immunomodulators,
right?
To
like IVIG.
That's correct.
Rituxan.
That's correct.
Cyclophosphamide.
That's correct.
Yeah, they will suppress the. Yeah, I mean those are probably the extreme forms.
Absolutely. So I mean, it's an interesting topic. It's interesting.
It's worth looking into.
It is, especially if you have it. There's also a genetic component to it. I haven't read a lot about that, but we can put some links up there for you to look into that. There is a genetic component to that. So just pay attention to your family history. It's really important. If you've heard, your mother had that, or she let you know about that, it's worth looking into if you are of reproductive age, and certainly if you want to get pregnant.
Yeah.
So.
Thank you, Joe. So my topic, as I said, it has to do with blindness and schizophrenia. And I was just reading, it was like Vice News. It was a very good article kind of covering this topic. And it piqued my interest because it just said, kind of posed the question, does congenital blindness, meaning people who are blind from birth, are protected from schizophrenia? So kind of digging deeper a little bit into it, found that apparently this has been kind of a mystery for past 40 years. And there are several studies where people were essentially digging through data. There's a woman in Australia that kind of went through 500,000 records of kids born blind, and they just couldn't find anybody. Okay, so that kind of piqued interest. Long story short, essentially what it comes down to is that schizophrenia by itself, so that's hallucination, hearing voices, seeing, images they're not there, it's not that, it's clearly it's connected to your brain, but it's also connected to the visual and the hearing, and just generally your senses. Okay, because the easiest way to explain it is that your brain is constantly trying to predict what's going to happen. Okay, so it's using the past experiences to create the future in your brain, right? And then your vision or all your other senses are recording what's happening currently and sending that signal to the brain, and that the brain is actually correcting its prediction constantly. So it's constantly like, okay, I'm predicting, it's wrong, but this is what's happening, and it's learning. Okay, so it's this ability of the brain to quickly process these predictions and fix them in real life. So now, if you're congenitally blind, first of all, you don't have any prior experiences visual, right? So you are not really, you're able to focus. Your brain is automatically using resources to focus on other senses, okay? And you essentially, so you become extra good in all these other senses. Schizophrenics are essentially opposite of congenital blind people, okay? They usually have visual problems, okay? So when they're very young, they usually have trouble with their vision. They either Some of them might be kind of stumbling, like they're not seeing right, not perception of depth and things like that. So they're opposite of the congenitally blind, which essentially creates this lack of the ability to fix these predictions. Okay, they're not able to. So they're predicting, right, as best as they can, but they can't fix the prediction because their vision is not as great. Okay, and that creates this disconnect in the brain of schizophrenic. Okay, also with the hearing, it's another thing. Congenitally blind people are very good with hearing, which is normal because they need to use other senses to. They hear pitch better. They hear. They can orient the sound. Okay, where they're looking, and also. The schizophrenics are kind of opposite of that. They can't. So they can't. They're not good in locating where the sound is coming from. They have trouble kind of hearing as well. So all these things kind of piled up together show us that really schizophrenia by itself is really not isolated to, say, a particular part of the brain. It has to do with senses, right? Joe? And they go into touch and sensory, as well. Congenitally blind people are more in tune with their, senses, with touch, which is normal. Again, they try to orient themselves. So
I listened. Yeah, just to tag along what you're saying is I listened to a TED Talk recently that really highlighted hallucinations as being, senses that we, like you said, we develop over time.
Right.
Especially, and your auditory, your sense of hearing, and in this case, he was really talking about your sight. So there was this neurologist who walked into his patient's office. Nursing home, excuse me, and she suffered from blindness. Now, and she complained to the nursing aides that she was seeing a particular image.
Right.
She was seeing all the time Kermit the Frog. Now, this differed greatly from schizophrenia.
Now, that's called... There's a name for that.
Oh, what is that called?
It's called Charles Bonnet syndrome.
Yes, that is
Charles
exactly
Bonnet
what he
syndrome
called
is
it.
interesting because so people that lose sight later in life,
That's right.
okay, they tend to manufacture hallucinations.
That's right.
They have hallucinations,
Right.
but it's really their brain again trying to do the same thing,
Well, it's...
But it's not schizophrenia.
But it's not schizophrenia because these visual hallucinations were not connected to her personally, and that's what really defined the difference between being schizophrenic and having these hallucinations. So my question is, let me just jump forward a little bit. At the end of his talk, he revealed that he himself was going blind, and yes, he had hallucinations. And he had the hallucinations of he saw triangles and shapes, and he was a neurologist. He was very aware of what was happening. So something happens to us. So what opened my eyes is we as a population should not be afraid of some of the things that may happen to us when we lose one or more of those senses.
Yeah.
We really shouldn't. We should report it more so that it becomes not that we normalize that we understand that it's happening. We report it
at
so
least
that
you know why it's
so
happening.
that you understand why it's happening,
Right.
so that you're not afraid and you're not alone in this.
Exactly. This whole topic is it's fascinating to me. So much into just to mention, how complicated it is. For example, if you're born blind and deaf, you don't get the same quote unquote protection from schizophrenia.
Interesting.
Right?
Yeah.
Why, I don't know. But that's what they found. And also there's two types of people that are born blind. Congenital blindness or peripheral blindness. Congenital blindness has more to do with cortical blindness. So congenital blindness can be split into cortical blindness and peripheral blindness.
I see.
So cortical blindness has to do more with an ability of the brain to process vision. Peripheral blindness is more of a kind of physical problem with the eye. Okay. And then, so cortical blindness, with the one that's connected to the brain, kind of people fall more into that category with protection with schizophrenia. Peripheral, I think they've had some cases of people with peripheral blindness having schizophrenia.
Interesting.
But it's still ongoing. People doing research, they're trying to figure out how this is, how our brain is working. I mean, that's fascinating to me.
It's an interesting world we live in.
Yes. So go out there and read.
And call us with your feedback.
If we said something that's wrong, which is very possible, put a comment down there. Send us an email. And in the next episode, we'll address that. And so that's it for us.
Thank you.
Thanks.